most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course,
Today,
Bob.
Brad, we're going to talk about safe ab and hip exercises with low back pain and sciatica. And this is very crucial because you don't want to stop working out because you have back pain. In
Right.
fact, some of these could help your back pain if you can strengthen your core.
If you do them properly.
If you do them properly.
And that's what we're going to
Go
explain
over today.
There you go.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. And yes, sir, Bob, you're going to want to join us on our social media and our website, bobandbrad.com, because we're always giving something away. Go to the giveaway section on Bob and Brad, or go to Facebook, Bob and Brad, and it'll be pinned to the top of the page. You want a shorter version of us, you're tired of us rambling on, go to Instagram and Twitter. We do a 60-second version of our show every day.
There you go.
All right, Brad, you going to go to work?
Oh, yeah, that's right. I'll be back. So this is a nice topic for me because with spondylolisthesis, which is oftentimes a chronic back pain.
So one of the vertebrae shifted forward on the other one.
Right. And that you can have sciatica associated with it, back pain with it, which I've been dealing with for about 8-9 years now.
You have done a tremendous job with it, Brad. I mean, seriously, for how active you are and what you still do with the amount of back injury you have is really...
Well, thank you, Bob.
Applauded.
But it's been homework.
Yeah, it has been homework. You worked hard on it, and you've strengthened your core.
Right, exactly. And I do what we're going to talk about. So should we get to it?
Well, the other thing, you want to strengthen the hips also because you prefer, a lot of stress to go through the hips and not the back.
Right.
When you're lifting. So
exactly.
you want hips to be strong too.
Yeah, and they all work together.
They all work together.
The number one rule is any of these exercises we show you, if they create pain, whether it's in the low back or down the leg, the sciatica pain, you want to not do that.
Absolutely stop.
Yeah. So we're going through about 7 or 8 exercises here. So you only may find 4 or 5 of them or 2 or 3 that you can do without pain.
And we'll show you adjustments you can try to see if you can do it without pain.
Absolutely. So shall we get on with this,
let's
Bob?
start with the
Number
first
one. Now this is one I do. I used to do it more. I'm down to 3 days a week.
Okay.
Not this first part, but you want to get your back. You see how I'm moving my back right here?
Yeah, he's making more of an arch or less of an arch underneath the back.
And you're going to put it in a location that feels no pain or a minimal amount of pain. And then you're going to tighten up your stomach muscles.
Yep.
And you can start out with just one knee to the chest. And with all these, we're going to shoot for 10 repetitions. I'm not going to do them here because we want to get on with it. So if one knee to the chest is too easy, then you're going to go 2 knees. Now, we're not going to grab the knee and pull up tight or do any of this. We're just going to tighten up, adjust the back so it's pain-free, tighten up the core, and lift till our knees are up towards the ceiling.
Now, some people will actually take their hands and put it underneath their back, Brad.
Yep, right here.
Or even underneath their back themselves in order to give it a little more support.
Yep, whichever way makes the back feel better.
Right.
Now, if you have a ball, and a ball does come in handy for some of these exercises, there's no way around it, and it can be very helpful. They're not that expensive. If you got back pain and it helps, it's worth it. This is what I do. It keeps my back in neutral, works my core very well, and this is
this
one
is
of
one of your staples, isn't it, Brad?
Yep.
You've been doing this for a long time.
Yep, years.
Yeah.
And I do 50 of them. Starting out with 10 is a good number. Okay, let's go to the next one.
Now, you need pretty good hip flexibility for that alone. I mean, you need to be able to abduct your hips pretty good. I mean,
a little key if you do this, it's a lot easier if you don't have pants on.
Sure.
But shoes help because a rubber part of the shoe grabs into the ball right there. And there's some little tricks that you do have to learn. Don't get too big of a ball because then it's hard to grab a hold of.
Exactly.
All right. So the next one, and this is a straightforward one. I put my hands across like this, knees up, and I just bring my head and my shoulder blades off the floor.
Yep, straight up.
Yep. So I'm not doing this.
Yep.
We want to go up like this and down, and that'll help keep that. Again, adjust the back so it feels good. Tighten the core. That goes with all of these, and work it like that.
With this one too, Brad, if it hurts, you may try to adjust your back a little bit.
Yep.
You could also put your hands underneath your back on this one too.
Sure.
A
Yep.
little harder, but and just bring your head up, straight up again. Yep, just like that.
Yep.
And that's maybe more for a beginner.
Right. Or,
So
yeah, depending on the degree your back is irritated at the time. Okay, good. What do we got next, Bob?
next we got opposite knee and elbow.
Right. And this is one of my cores. Um, I'll go like this, knees up, and again, make the adjustments with your back, tighten your core, bring your right elbow to your left knee, and you don't have to touch. But if you go that direction, all we're doing is getting some of the oblique muscles.
But look again how he's keeping his back really pretty straight.
As
You know what I
straight as
mean?
I
Yeah.
can. I'm thinking about it. I'm
He's
really
not. We don't
focused.
want to have the curled back, the curled low back
Right.
on
I'm
this.
not going way up like
Yeah.
this.
And
Okay.
again, you have a problem, and this feels okay for you.
I use the ball, and this is how I
You
do it.
do.
I go like this, pick up the ball. Don't expect to do this right away because holding the ball and doing these, it takes a little bit. But you just start out with baby exercises, and this one really, it just feels good on my back all the way around. I don't have any problems with it at all.
Again, someone with sciatica, that could be a problem.
Yep, exactly.
I
So
mean,
that's the question mark one.
yeah, stop immediately if it starts causing pain down your leg, or if you feel pain down your leg afterwards,
Right.
right afterwards.
Yep. And then, of course, you're not going to hop up like that.
Right.
If you're down here, you got to think about,
Rolling to your side.
yeah, rolling to your side, keeping a neutral back.
Yeah. Tightening up
Mm.
your stomach, maybe. even.
Yeah, furniture next to it, and it all depends on how bad your back is, of course. It could be if it's so bad you may not be able to do these, but
Right.
all right, hips.
Get some hip strengthening.
We're gonna work the gluteus. So in this position, we're gonna find the comfortable position, fully arched or up. Usually the times it'll be in between there somewhere. Tighten up your core, and we're gonna do hip extension at about this speed.
What's nice about this one, you're actually getting some back strengthening with this
Oh yeah,
too.
yep,
So you're getting kind of a double benefit. And again, if you hurting, readjust the spine
yep.
and also tighten up your abdomen and see if any of those take away the pain.
Yep. Sometimes you just go to the ball
Right.
and do it with a ball, and that takes a lot of stress off of your
That
back.
this takes a lot of stress
Yep.
off the back. Absolutely.
And it is a little bit cheating, but you're doing it for a good reason to protect your spine, get exercise while that back heals up.
Now, interestingly enough, your glutes, the butt muscles, actually kind of become deactivated with back pain quite often.
Sure.
And so we need to reactivate them,
Yep.
and that's a great one for that.
Yep. Exactly. Now the next one, sideline. If we're talking about hips, it's nice to keep the hip abductors strong to stabilize your spine, particularly with walking. The first one I'm going to show is hip abduction. So sideline, and here you may have to make some little adjustments so that you're comfortable. So forward and backwards. And if you're not comfortable, just don't do this one.
Right.
And we're just going to go up and down like this.
And generally, what's going to make you more uncomfortable is if you go more back like this, because now you're getting a little twist
Yeah.
in the back while you're doing
Exactly.
this. So you want to be really generally straight up and down.
Right. And the tendency is to kind of kick forward and bring your toe up like that. We don't want that. We want to keep it straight in line with your body.
Toe
And
pointing straight forward.
yep, even a little bit down may help a bit.
Sure.
You'll feel that hip abductor working. Well, there's another way to do this, but while I'm down here, I'm going to show you the clam shell. This is a nice one. It's a little easier. It'd be nice to have a pillow, Bob. Don't worry
know,
about
I
it.
was
Bob.
looking.
No,
There's
don't
no pillow
worry.
here.
Nah,
I looked before. Oh, wait. Here,
Oh,
I'll give you the have a nice day or have a good day
Oh,
pillow.
good. Thanks. So, and simply the clam shell. It's not
Yeah.
a real aggressive, but I can tell you
This is a great one because
it's harder
gonna,
than it looks.
yeah, it's going to work the glutes and the hip abductors, and this is a fantastic one to do
Right.
for back pain.
Now, I did mention there's another option for the hip abduction, and if you have the ball, you can try this. Now, if you're not used to the ball, this is pretty wobbly, but so you have to have something to hold on to, a chair, a wall in front of you. I feel comfortable on the ball because I use it a lot. And then you go like this, and this supports the back. Again, tighten up the core, get things in that neutral, pain-free position, and then do your exercise. And then naturally get off the ball slowly, go to the other side.
Yeah, again, great exercises if you can do them because they're going to help you in the long run
Right,
do things correctly. Like
right,
what when you're working doing something, you want to keep your back straight and you want to put the stress on the hips.
right.
So
Yeah, if you have an injury, the worst thing you want to do is just lay down and let it try to heal
right,
without activity.
no, you got to get
Ah,
moving, got to get walking too. Remember, Brad and I can fix
ah,
just about
yes,
anything.
except
A
for
broken heart,
there you go.
but we're working on it. There we go.